All right, today we're going to take a tour of the lower leg. But this isn't just about anatomy. Think of it more like a geological map. We're on the hunt for the built-in fault lines, those predictable ways this amazing piece of engineering can fail when it's put under pressure.
So, let me ask you this. What if breaking a bone wasn't just some random, chaotic accident? What if your bones actually had a kind of blueprint for how they break? Well, that's pretty much exactly what we're going to see. So come on, we're going on a guided tour, starting at the knee and working our way down to the foot to uncover the hidden logic behind these injuries.
Okay, first stop, the patella. You and I know it as the kneecap. It might be a small bone, but it's at the center of some incredibly powerful forces, which leads to some very, very predictable injuries.
So, when a kneecap pops out of place, what's fascinating is the direction it goes. It almost never goes inward, toward the other knee. Nope. Because of the specific way the femur and the kneecap are shaped, it almost always gets yanked to the outside, laterally. And this creates a classic telltale bruise pattern that doctors look for. It's a dead giveaway.
You've got to picture the kneecap living in this constant state of tension. It's a tug-of-war. You've got the massive quad muscle up top pulling it one way and the super strong patellar tendon down below pulling it the other. Now, if that bottom rope, the patellar tendon, tears, the quad wins. Whoosh! It yanks the kneecap way up high. We call that Patella Alta. But if the top rope, the quadriceps tendon, tears, the patellar tendon wins, pulling it down low. That's Patella Baja. So the bottom line is, where that kneecap is sitting tells you exactly which rope just snapped.
Okay, here's a classic puzzle for doctors. You look at an x-ray and see what looks like a broken kneecap. Is it actually a fracture, or is it a bipartite patella, a totally normal thing where the bone just never fused into one piece when the person was a kid? The clue? It's all about location, location, location. A bipartite patella is almost always in the upper outer corner. A real traumatic break? Well, that can happen just about anywhere else.
All right, from the kneecap, let's head down to the absolute powerhouse of the lower leg, the tibia, the shin bone. This thing is the workhorse, it's the main load bearer, and, maybe not so surprisingly, it is the most commonly fractured long bone in the entire body.
And what does that mean in the real world? Well, it means a lot of time. A tibial shaft fracture is just notoriously slow to heal. We are talking an average of 10 weeks, and honestly, it's often much longer. That number isn't just a number. It represents a huge disruption in someone's life.
So, the tibia tends to break in a few characteristic ways. A tibial plateau fracture, that happens when you land really hard on a straight leg. The force drives the femur down onto the top of the tibia, and it usually breaks the outer or lateral side. A pylon fracture is even more intense. That's when the talus bone in the ankle gets slammed straight up into the bottom of the tibia, like a piston. And of course, there's the plain old shaft fracture, the most common of them all.
Now, for a really specific fracture that you pretty much only ever see in teenagers, it's called a Tillaux fracture. And the reason it happens is just fascinating. See, the growth plate at the bottom of the tibia, it closes in a very specific order, from the inside out. This fracture happens in that very short window of time when the inner part is already fused solid, but the front outer part is still open and, vulnerable. It's a timing thing.
And building right on that idea, we get the triplane fracture. It's like a Tillaux fracture, but with an extra layer of complexity. It has the same vertical and horizontal breaks, but it adds a third fracture line that runs up into the main shaft of the bone. It's just a perfect example of how a simple pattern of failure can get a whole lot more complicated.
Okay, let's continue our journey down to the ankle. Now, this is where things can get a little tricky, because sometimes an injury that looks like an ankle problem is actually hiding a secret much, much higher up the leg. So, meet the Maisonneuve fracture. It is a true chain reaction. The force starts down at the ankle, prying the joint apart. But it doesn't stop there. The energy shoots upwards, ripping the membrane that connects the tibia and fibula. The source material calls it the rippin' and the tearin'. And that force finally exits way, way up high, causing a break in the fibula right near the knee. This is why a good exam is so critical. If you only x-ray the ankle, you could completely miss the real problem.
We've made it. Our final destination is the foot. It's an incredibly complex structure, and it's home to some of the most intricate and, well, as we're about to see, some of the most colorfully named injuries out there.
And that brings us to the Casanova fracture. It's the nickname for when someone breaks both of their heel bones, which happens from a major fall, like jumping out of a second-story window. And this is a perfect, if painful, example of how force travels through the body. Because if you see this injury, the very next thing you do is check the spine. You have to look for a related compression fracture, usually around the T12L2 area.
So, how do you spot that complicated heel fracture on an X-ray? Well, docs can use a surprisingly simple bit of geometry called Bowler's angle. On a side view X-ray, they just draw two lines along the top surface of the heel bone. Normally, the angle should be between 20 and 40 degrees. But if that angle flattens out to less than 20, that is a huge red flag that the heel is fractured and collapsed.
Now check this out. At the base of the little toe, two very different fractures can happen in almost the exact same spot. An avulsion fracture is right at the very tip of the base. You see it a lot in dancers, and it usually heals just fine. But move just a little bit further down the bone, about 1.5 centimeters, and you have the Jones fracture. And this one is famous for being a real problem, with a high risk of not healing, because that one little spot has a terrible blood supply.
And finally, the Lisfranc injury. This is the most common foot dislocation, and it is absolutely critical not to miss. The Lisfranc joint is like the keystone in a Roman arch. If it gets messed up, the entire structure of the foot can just collapse. And sometimes the only clue is something called the flex sign, which is just a tiny, tiny chip of bone on an X-ray. If you miss that little fleck, you're risking chronic pain and arthritis for that person down the road. It's a big deal.
So, we've traveled all the way from the knee to the foot, and we've seen how these breaks and fractures aren't random. They follow these predictable patterns, these fault lines that are literally built into our anatomy by physics and even by the way we grow. And it really leaves you with a final thought. Our bones are the product of millions of years of evolution. So what stories do their failures, these predictable breaks and tears, really tell us about the limits and the genius of our own design?